So, welcome back. In this final class on the epidemiology of communicable diseases, we'll be looking at prevention and control. This of communicable diseases. These two terms are often used interchangeably and often used as synonyms of each other, but we will be seeing the differences in the use of the word prevention and the use of the word control, and why we have why we need prevention and control efforts and what those efforts actually are. So for us to understand this, we need to go back to what the goal of public health is. Go back to what the goal. So the goal of public health actually supposed to be public health, not medicine. The goal is to promote health, preserve life, restore health when it is impaired, and minimize suffering and distress. And the word to embody this definition or this explanation, this ideology is prevention. A situation where either you are promoting health or you are preserving health if there's a threat to it, or you are restoring health if something has gone wrong and affected health and made health impaired, or if the impairment is there permanently, how do you minimize suffering and distress? So the definition of prevention in public health and in epidemiology specifically, refers to all actions aimed at eradicating, eliminating, or minimizing the impact of disease and disability. Or if none of this is feasible, retarding the progress of the disease and the disability. And therefore, the idea of prevention is best understood in the context of levels of prevention. Some of us at younger, when we were learning, we're taught stages of prevention. But in public health and epidemiology, we prefer to look at it as levels. But there is some correlation between stages and levels of prevention, and we will see that as we go along. But we are going to be discussing levels of prevention. So the current teaching is that there are 5 levels of prevention: primordial, primary, secondary, tertiary, quaternary. Primordial, primary, secondary, tertiary, and quaternary. So for you to have successful prevention, and that is the reason why all the other lectures have led up to this. For you to have successful prevention, you need to know what is the causative agent. You need to understand the transmission dynamics, disease transmission dynamics. You need to have a good grasp of what the risk factors are and what groups are at risk of the disease. Also, it will be important to know what is available for early detection and treatment measures. Also, we need to know what the natural history of the disease is. So if there's no intervention, how will that disease turn out? What are the likely options of the outcome of that disease in the absence of existing intervention? And then you have to have an idea of how the measures can be appropriately applied. Okay. Now, not every disease can be prevented. Not every disease can be prevented. But there is the beings. So somebody, I think some time back, somebody was asking me about acronyms in epidemiology. We don't have too many, or shortcuts. We don't have too many, but this is one that you may find useful. The beings acronym for preventable causes of diseases. So diseases can be caused by biological factors. Another B is that it can be caused by behavioral factors. Disease can be caused by environmental factors or immunological factors, nutritional factors, genetic factors, or as a result of challenges with services, social factors, or even spiritual factors. That's the Bain's model. But that these are all things that it is possible to apply some sort of prevention activity or the other. But levels of prevention clearly deviates away from the Bain's model that just identifies preventable causes of disease and goes to levels of prevention and the type of response that is fitting for that level of prevention. So you can see this table, it's only focusing on primary, secondary, and tertiary. But you will see in other tables where primordial has been added. And then I will discuss quaternary with you as well. So let's take it from primordial. Stage of the disease is pre-risk factor. Pre-risk factor, that's the stage of the disease in primordial. Primordial level of prevention, stage of the disease is pre-risk factor. Pre-risk factor. So pre-exposure. Pre-exposure. So you can either say pre-risk factor or pre-exposure. That's primordial. The level of prevention is primordial. The type of response, health promotion. That the major type of response there is health promotion. And then for primary, the stage of the disease is pre-disease, which means exposure has happened, but the disease has not yet occurred. Pre-disease. That's the stage of activity in primary prevention. And then the type of response, the type of activities carried out to implement primary prevention are health promotion and specific protection. We'll come into this in detail. Then you have secondary prevention. Again, see the word latent coming up, and I just want you to please just kindly do not put so much focus and emphasis on this definition of latent here. But secondary prevention is post-disease. Secondary prevention is post-disease. So you can actually correct this in your own notes. You're taking notes. Stage of disease pre, secondary prevention is post-disease. It's post-disease. So early diagnosis and treatment are the types of response. While tertiary prevention, I think I'm going to take this slide out because it's not helpful so much. While tertiary prevention is post-disability from disease. Post-disability, so post-disability from the disease. And then you have limitation of disability and rehabilitation. So, but let's look at the typical levels of prevention. I've told you there's a fourth one, which is quaternary. Quaternary prevention. And see whether we can understand what each of these levels are. Primordial prevention. In primordial prevention, there is not yet exposure to risk factors. The risk factors or the causative agents of the disease, the individuals or the people are not yet exposed. Are not yet exposed at all. There isn't any exposure yet. So, for example, let's look at the example of lung cancer. And the risk factor for lung cancer under our review is cigarette smoking. You can only implement primordial prevention if cigarette smoking has not occurred at all. So there's no exposure to the risk factor. Because primordial prevention consists of actions, activities, and measures to inhibit the emergence of risk factors. Whether those risk factors are environmental, economic, social, or behavioral conditions or cultural patterns. We want to make sure that risk factors do not occur, because it's the risk factors that lead to exposure, that lead to disease. Important. I'll give you another example. Hypertension, risk factor for hypertension, sedentary lifestyle, diet, poor diet, or unhealthy, I think is the right word. Unhealthy diet, sedentary lifestyle. Those things, and physical inactivity, aside from smoking and all of that. If you can only implement primordial prevention when the population group you are dealing with has not been exposed, to any of these risk factors. Once exposure to risk factors occur, you are no longer dealing with primordial prevention. You need to start thinking primary prevention. You need to start thinking primary prevention. So a lot of what you will do from primordial prevention will be among population groups that have not yet been exposed to the risk factor. For example, children, or even prenatal, or children, or young adults that have not yet been exposed. Another thing you can do, set of people, is how do you protect an entire population from experiencing or being exposed to the risk factor? For example, if there is a community, a locality, where there is no advertisement or sales of cigarettes or tobacco products, how do you ensure that tobacco products are not advertised, sold, or grown in that environment? All of that comes into primordial prevention. So health promotion and education activities, and also legislature and policy. So you say, what are the interventions under health promotion? 1, health education. 2, health promotion. For example, legislation. Now let's go to primary. In primary prevention, the risk factors or the causative agents for a particular disease to occur have already started to happen. So when you get to a situation where there's already exposure to the risk factor, but disease has not yet occurred, there's exposure to the risk factor, but disease, when I say disease, I mean there's no apparent illness. So primary prevention seeks to take action prior to the onset of the disease, such that even though there is exposure to the risk factor, you can aim to say this disease will not occur. So this is the pre-pathogenesis phase of the disease. Now, activities under primary prevention are two main categories. One is health promotion, and the second one is specific protection. Health promotion and specific protection. I'd like to explain. Under health promotion, you have things like educate people. So if somebody was living a sedentary life, if the person understands the value of physical activity by health education, the person starts to exercise physically, and then whatever untoward effect of not being physically active, you are able to reverse that and prevent the disease from occurring, like a non-communicable disease like hypertension and diabetes. Another thing you can do under health promotion is environmental modifications. For example, stopping air pollution, because we know that there is a link. There is a causal link between exposure to environmental air pollution, especially air, land, and food pollution, and development of non-communicable diseases. Or is it nutritional interventions, where you talk to people and let them know the right sort of foods to eat and all of that? All of that is health promotion. Or any campaign to change lifestyle and behavior. All that is health promotion. Now, another part or aspect of health or primary prevention is specific protection. Specific protection. And specific protection simply says, what specific thing are you going to do to protect these people against a specific organism? For example, immunization. Immunization, it confers specific protection. So you are immunized against COVID, or immunized against typhoid fever, or immunized against cholera. It confers specific protection. Or food supplementation. That's another very good example of specific protection. Food supplementation. And so on and so forth. Or there are some disease conditions where even before the onset of the disease, you can institute chemoprophylaxis. All right. So that's about primary prevention. Any activity to mitigate the occurrence of risk factors. Risk factors have already occurred. So anything you can do to reduce the effect or the impact of risk factors and reverse it so that risk factors do not lead to the occurrence of a disease. All right, let's go to secondary prevention. So secondary prevention, in secondary prevention, the disease has already occurred. Signs and symptoms have kicked in. No, apologies. In secondary prevention, the disease has already occurred. In some cases, it's subclinical. In some other cases, it's full-blown clinical. But the disease is already occurring. So it's not just dealing with risk factors, the disease, we're dealing with the disease themselves, the disease itself, or the diseases themselves. It's already there. But it may not be visible because of absence of signs and symptoms. Or it may be, remember our discussion around subclinical cases. So the main idea of focus behind secondary prevention is to identify the disease early so that treatment can occur, because it's very clear through science that early detection ensures that treatment is instituted, and if people's ill health is detected early, they can get all the support to ensure that that disease does not progress to a disability. So the specific interventions under secondary prevention are early diagnosis and treatment. Early diagnosis and treatment. Examples of early diagnosis are screening tests. Screening tests. Now, the beautiful thing about screening tests is that screening tests are done before or at the time when there are no signs and symptoms. So you must be apparently healthy. That's when the screening test picks it up. Ah, you didn't know you had this. Yes, you've always had it, but you didn't know. Or you've had it for a while, you didn't know. So secondary prevention attempts to arrest the disease process and restore health. All right. The second part of secondary prevention is treatment. You write early diagnosis and treatment. So treatment means that you are able to apply either a clinical or a pharmaceutical or surgical intervention that is able to either stop what's going on or reverse it. Stop the disease process or reverse. All right, let's look at tertiary prevention. Here, disease has occurred and has progressed to complications. Disease has occurred and has progressed to complications. And these complications are those kind of complications that cause disability. Cause disability. So what do we do such that a disease entity will not end up as a disability? So there are two major things under tertiary prevention. One is limitation of disability. What do we do to reduce the distress of disability? What do you do? The other one is rehabilitation. Rehabilitation. So if somebody is experiencing a disability, can you do something to help the person overcome that disability? Is it possible? Anything you do will be under tertiary prevention. Let's look at disability limitation a little bit more. There are 4 levels or stages of disability. 4 levels. So when you use the word disability, you use it very broadly. And there are 4 levels. It all starts with disease. Abnormal. Then impairment. Impairment is a loss or abnormality of either physiological, psychological, or anatomical structure. So a disease oftentimes leads to impairment. A disease oftentimes, if it has its way, it wants to lead to impairment. Loss or abnormal functioning psychologically, physiologically, or even anatomically. All right, so that's impairment. Let's look at disability. It's a restriction or absence of the ability to perform an activity that would have normally been considered as normal for that particular person. So, for example, somebody is supposed to be able to tie his or her shoelace, but because of an injury, the person is not able to tie his or her shoelace. The inability, the loss of function, the injury on the hand is the impairment. The inability to tie the shoelace, the inability to physically hold the shoelace and tie it is the disability. The final level is handicap. Handicap goes beyond physical or mental inability to do something. It also takes into cognizance the effect of that person in the society because he or she is not able to do something. And with handicap, individuals who are handicapped are not able to fulfill their normal, natural role. So without some modification, in this case, we call those medications rehabilitation. Someone who's handicapped is not able to integrate or interact in society in a manner that is considered normal. All right, examples help. Let me give us an example. Somebody has an accident and has an injury, blunt force trauma to the eye. That injury is the disease. The injury is the disease. The impairment is inability to see. So the injury causes an impairment, inability to see. The disability is inability to, because of inability to see. The disability is seen in, can still say it's inability to see, but not being able to move about and all of that. While the handicap is called blindness. So this person is blind. In a year, somebody is blind. You know, the person is not able to interact with society as he or she should. We're bringing it up all under the concept of tertiary prevention. Because the whole idea of tertiary prevention is to limit disability and impairment. Limit it. So the other side of tertiary prevention, we talked about limitation of disability, is rehabilitation. Rehabilitation is done for people whose disability has occurred and are irreversible. You can try to support the persons to the highest possible level of functionality, functional ability. So rehabilitation can be medical, vocational, get the person some other job to do, social, and psychological. All right. Let's take a pause here. I'll be happy to take questions. Okay, so the final level, the fifth level for now, is the quaternary, spelled as quarter. Quaternary. Yeah. Now, this level is interested in preventing the effects, negative effects of a term we call over-medicalization. In over-medicalization, the treatment constitutes a risk factor for more disease, distress, and other public health, negative public health issues. All right. So over-medicalization occurs in different ways. For example, there is the tendency in certain crimes that when somebody presents with any complaints or signs and symptoms, person is subjected to a full barrage of tests, whether those tests are needed or not, even before a health worker takes a history or asks questions. So come into a health facility and say that you're feeling a bit weak and dizzy, and before you go home, you would have done a lot of tests up to an MRI. You would have done an MRI just because you say you're feeling weak and tired. You didn't even complain of headache. And treatment in itself has negative effects. Medical errors, an example of the harm caused by over-medicalization, medical errors, like giving the wrong dosages and all of that. So this says, what do we put in place by way of patient education, by way of health worker education, policy and legislature to ensure that negative impact of interventions are not felt by the would-be beneficiaries. So that's quaternary prevention. So the stage, quaternary prevention is at the stage of treatment is being implemented. And you want to say, okay, let's prevent that negative issues from happening to the patient because they came for treatment. Typical example is prevention of things like hospital-acquired infections. What are some of the things put in place in terms of infection prevention and control to protect someone who came to the hospital with a particular disease from going home with another disease? And that's the part about quaternary prevention.